You are listening to the Revolutionary Love and Resilience podcast. I'm Shelby Lee, and I am so honored to be here with you today. This podcast bridges the personal and professional, creating space for experts in the wellness and well-being field to be both vulnerable and share their deep wisdom from their years of experience. This podcast weaves trauma awareness, inclusivity, and inspiration for every single person to be able to heal, grow, and become who they want to be, to step into their full authenticity and expand their capacity to claim their best lives as they journey through challenges towards revolutionary love and resilience. So I'm so excited to welcome you, Kirsten, to Revolutionary Love and Resilience. This podcast was designed for conversations like we're about to have, bridging the professional and the personal in the world of wellness and healing arts. So I would love to introduce you to the whole world. I have known you for a very long time. You're a dear friend and colleague, and I am just so honored that you're spending your time here with me today. Thank you for being here.
Thanks for inviting me.
You're welcome. So I'd like everyone to know that Kirsten Mackey is a doctor. She's an osteopath. She's a board certified family medicine physician and traditional osteopath with specialty training in functional and holistic medicine. She's also a yoga instructor and a former competitive snowboarder and Division I field hockey player. Dr. Mackey learned the importance of a holistic approach to healing and medicine. Her experiences led her to attend osteopathic medical school in the Bay Area and complete her training at the University of Nevada, Reno. She formerly served as a clinical faculty member at Western University College of Osteopathic Medicine and currently teaches at the University of Nevada Family Medicine Residency, as well as the Shakti School, an Ayurvedic practitioner program. Dr. Mackey is excited to return to Lake Tahoe after most recently working for several years at a highly regarded osteopathic practice in Santa Monica, California. And I also want to share with the world what an incredible musician you are, if you don't mind. You are so well-rounded in all of the gifts you have to offer the world. And I'm really looking forward to how this conversation unfolds. Is there anything you'd like to add that I didn't say about you?
Thanks for the intro. I think we'll probably get around to the other aspects or expand on some of those things. But in general, I think a lot of people, unfortunately, don't know what osteopathic medicine is. And so just to throw that out there right in the first part of this, I think would be useful. So in this country, osteopaths are trained physicians who receive additional training in how to diagnose and treat with their hands. So it's a form of body work that applies and integrates medical sciences, physics, a lot of anatomy in our training to treat injuries, disease, dysfunction in the body. So yeah, I'm sort of a body worker with a medical background, essentially.
Yeah. So the word holistic really sticks out as you're talking about your training and what you do. And so I'm really excited to hear how that gets pulled into the way you work with your clients, like what makes it holistic.
Yeah, actually, it's like a really common misunderstanding that osteopaths are structural doctors because of not only the name. People are like, oh, osteo, bone, is that like an orthopedic surgeon? Or so one of the founding osteopathic principles is that this is actually like the first tenet of osteopathy, is that a person is comprised of mind, body, and spirit, and rational treatment of any dysfunction or disease or injury acknowledges and applies this notion. So the body is just the doorway through which we access the whole person. And so it really is holistic with a W kind of medicine. Yeah.
Awesome. Well, I am a huge fan. You know me, I love alternative treatments, and I feel like it fits into both mainstream and alternative somehow. And I've actually received some manual treatments from you, and I'm so often just amazed at how it touches the layers of the emotional world too. And I can come in and not have anything on my heart or mind, and all of a sudden I'm realizing this is healing all the way through every layer of my being.
Yeah, there's some other things going on there. I feel like you and I, with your background, have only just kind of touched the surface of how those two worlds intersect and overlap. We don't talk about it a ton in osteopathic medicine, and I'm kind of interested in bringing that emotional, more trauma world into what we do as osteopaths with the body. So I'm excited to have this conversation and more with you about that stuff.
Absolutely.
Yeah.
So I'm curious, what inspired you or inspires you to be doing this kind of holistic medicine? And what inspires you to be with the patients that you're working with? What lights you up about that?
I feel so lucky to be playing the role as a medical provider, be playing the role that I do. You hear about physician burnout and people in in the allopathic world, which means they work in, the hospital or the clinics that we normally go to, having a lot of trouble with the current paradigm in terms of being either overrun with patients, not really being able to practice the way they want to, et cetera. And I come home every day and I don't feel any of that. I feel like, that I get to spend a lot more time with people and therefore get to learn a little bit more about the root of what's going on. And people really appreciate it. So I get all this great feedback about the difference between going to a urgent care or the regular doctor world and coming to me. And it's really rewarding what I get to do with people and get to the bottom of their issues.
Yeah. I just felt myself take a deep breath hearing that you don't have to be in burnout as a doctor, and that you get to actually feel connected to your inspiration around this.
Yeah, I think that a lot of doctors are villainized, but a lot of these people are my friends, and they're just caught in this system, and they don't actually have the tools to be out of the system, or they have debt that keeps them in the system. And I think it's unfortunate, but it's kind of why I got into medicine. Your original question was like, what inspired me to do this, which it was kind of like, as a young person getting injured through the various sports and things that I was doing, I got a glimpse into the disparity that is Western allopathic medicine, that really is just looking at one side of things that are going wrong with people, and symptomatic relief and getting you back out on the field, so to speak, but not looking any deeper. And something in my teenage body was actually able to say, because all these things happened starting as a teenager, was able to say, this doesn't quite add up. This isn't a healing experience. I think I could do better than these people. So yeah, it's unfortunate. I think that there's a discrepancy in the education.
Yeah.
Doctors. Yeah.
So it sounds like you've been through a lot with your own treatment in the medical world. And I'm curious, when we're talking about revolutionary love and resilience, if there's a way to connect with your own story, like through your journey, how have you found resilience and revolutionary love? How do you define those things in your own healing process, your own growth process? And are there any personal stories you like to share with us of how you have known for yourself what it's like to be part of the medical system or anything like that. And then bring that into your current level of resilience and love in life.
Yeah, I had to think about this one because I knew this podcast was going to be about revolutionary love and resilience. And so I read through what you had to get inspired. I read through what you had to say on your blog about revolutionary love, which, by the way, I always love reading what you have to write. And you always do a really great job of balancing your personal experience with a professionalism that is really hard to do. So, yes, good job on that.
Thank you.
Yeah. So, I'm not used to being in this like more vulnerable, personalized state because of the way that we're trained as physicians to just completely put ourselves aside. And so, this is one of the only like formal interviews that I've done that I do want to tell some of my story and share that, because I think the way you do it is super powerful and can be really meaningful to people. So I appreciate that you're doing this podcast.
Thank you. Wow. I just want to take a breath with that, just honoring the transparency that you're sharing, and that it takes some bravery and courage to take our expert hats off, or, like at the same time, also allow ourselves to be human beings with paths that have brought us here. So thank you.
Yeah. Yeah. You're welcome. Yeah. It's almost like, when you're talking with a patient or a client and you're like, oh, my mom had that problem. Or like, I went through that when I was 25, or, whatever you want to say those stories. And I'm always like, no, don't talk, not allowed. Don't talk about yourself. And there's reasons for that. And they're good reasons. But I feel like, that separation could be a little bit closer, I think, and it would be really useful for people. So anyways, what I really liked in your blog was that one of the aspects or definitions that you had on revolutionary love was that it's like a kind of love that goes against what you believed it to be or what you felt like you needed it to be, or you're like this concept or expectation of what love is. And then the revolutionary love is that you realize that there's a transformation from one idea of love, which in my personal story was like an idea of love that I had made up in my mind, to another more organic form of love that came up naturally in my body. And that goes for resilience as well, kind of like grit versus allowing that resilience to come through.
Yeah. Can you say a little bit more about what you mean by grit?
Yeah, for sure. So I guess I have always identified resilience as in like true grit and trying hard and coming back stronger, etc., has never been my particular challenge in life. And actually, I think I identified quite a bit with being resilient in that way. I was always like I'm tough enough to handle anything and any challenge that presents itself. I'm going to do better than I even think I can. And I was always like, in athletics or in academia, I was always in my mind the hardest working one in the room or on the field or on the half pipe. I was the first one out and the last one in, and I was hiking a pipe all day so I could get stronger. And like I used to like literally go on, like if I went on a trip to India or Thailand, or I would like purposefully sleep on like a cement floor just to like toughen myself up. Like I would not sleep on the bed. I would like go on journeys with my bare feet so that my feet would get tougher. And then like I would literally like, I think I remember burning my feet like really badly in Hawaii walking on a volcano, just like purposefully, because I was like, these feet are getting a little weak, you know?
Mm. Wow, I'm learning more about you than I thought I already knew. I've seen you on that pipe while I'm napping at the end and you're hiking.
Yeah,
And I've seen glimpses of that. And so I'm curious when you kind of contrast this grit with your idea of resilience, and you can share a bit about, okay, so then what's resilience for you?
Yeah. So I think, thinking about this topic, I think true resilience, it requires first a surrendering to the limitations and allowing one's true nature to then show up. And don't get me wrong, like I've had a few meltdowns in my 20s and 30s in my adult years, through medical training and losing people, loss of relationships, a parent being sick, etc., where I really just like couldn't maintain my cool, tough attitude and had to really ask for help and let my walls down. And where then I got to experience this sort of natural resilience that was underlying all of this like effortful grit, as we're talking about, that like lo and behold, like what happened, like all of my people, for instance, would come in and really help me through that period, or I would discover that I really did have the resilience once I was able to sort of surrender to the process. That's I think where the real strength came in.
Wow, I love that. I think I'm getting a sense of it in my body as you're talking. And it's like different than like the original resilience kind of felt like muscling through and pushing through. And it sounds like something has to feel safe enough to like surrender, as you're saying, to relax, to be receptive or more at ease. Like there's a softer quality to this resilience you're describing. Am I getting that?
It's a softening, and I don't think necessarily safety precedes it, but maybe, sometimes you're in such a challenge that there really is no choice to be hard. And so you just sort of collapse in a way and do that trust fall backwards. That can be actually really rewarding. Sometimes actually, like from a health standpoint, I see this over and over and over again in my practice that people are pushing and pushing and pushing in whatever ways they do in their particular lifestyle. And it's only after a health challenge, a health downfall, where they literally don't have the choice to keep being a mega marathon runner or holding 4 jobs down and being a mom, or, whatever it is, the way that they push the limits, their body shuts down. And then they're in that place of like, I have no choice to keep going in the same direction. And that's where I feel like the resilience comes in.
Yeah.
Yeah.
So you really learned it through trial and error, it sounds like, and it wasn't a choice. It just kind of naturally made a shift. Is that what you're saying?
Yeah, I think ultimately it does for most people, that we realize we're not invincible and, our different systems shut down. But yeah, for me, it certainly showed up as a kind of an inevitable, not an option, but to change kind of thing or transform.
Yeah. Do you have any specific stories around your health or like your emotional life where you felt really challenged and you had to do that surrendering, or the surrendering just came?
Yeah, I think I give you a lot of examples, but like, I guess I'm trying to think of which one is a great one to share in terms of this particular topic. I think it makes sense to talk about kind of my younger spiritual days. And that's like close to when I think I met you in my mid-20s. So just before that time period in life, before I went to med school, et cetera, I was, living in ashrams, traveling to India, trying to be like yogic and vegetarian, and in retrospect, like mega spiritually bypassing.
We're going to come back and have you define that.
Yeah. I valued like always in the same sort of like, I'm going to be resilient and tough and like larger than life kind of thing. I valued rising above and always being like the highest form of love and presence as possible. And this to me was like basically how that manifested in my life, was being available and present to all the people in my life at all times. And so when I felt like I couldn't give anymore, I would like literally be like, okay, I need to call someone and check in on them. Like it was this like ridiculous level of helping people. And I think a lot of healers run into this problem as well. But simultaneously at this time, I was trying to recover from like a legit eating disorder that started in my late teens. And so I was like trying to be this really strong, sturdy force for everyone in my life. And then going home at night and using food to sustain that level of energy and presence, and or maintain a certain level of numbness so that I could continue to be putting on that mask during the daytime or whatever for people. So that would be like one big example that, over a decade ago, I can happily say that I'm through that challenge of life. But putting others first before me was really not the yogic thing to do. Yeah.
So how would you define spiritual bypass? And then also how did you tap into resilience or revolutionary love in the process of healing from this?
Yeah. So spiritual bypass in my experience, or what I was referring to in that context, is kind of sticking to the rules of some dogma that you're drawn to, or I was drawn to, and not really applying it or living by it on a truly deep way within my own spirit. So applying it to everybody else except myself, and kind of pointing my finger outward and saying this is wrong or this is right, or trying to pretend like I could guide other people, but really not practicing what I preach on a deeper level. But I think unfortunately happens. It's not just me and this like my yogic and Buddhist teachings that I was following in my early 20s, but it's the underpinnings of a whole diversity of spiritual beliefs. Do unto others, give of yourself, be selfless, always lend a helping hand, be there for your family and friends and strangers and starving people in other countries, and try to basically measure up to Mother Teresa, and like always give all of your energy away. I sometimes talk about this with patients that like modern asana is commonly like a lot of extension poses, and like open your heart and give it all away, and they're moaning and they're like releasing. And so it's like this culture of giving all of your energy away.
Mm.
So
I'm hearing this thread throughout what you're talking about is like
yeah,
the helper mentality and how it can be really double-edged.
it can be. I think that probably some people really need to hear the like selflessness talk or whatever, because there's probably some really selfish people out there. But then I see a lot of illness, especially with mothers, and like this martyrdom that a lot of people can get themselves into, specifically working moms, where they're giving everything away and they think they're doing the most spiritually highest practice of like being selfless, but it's actually literally killing them.
And they're not actually, like, I think about embodiment. And when we're talking about spiritual bypass, all their focus is outside of their own body. And so they're not actually living in their own body and listening to how they can help themselves, what they actually need, what they want, because they've been conditioned to think, if I can be of service out there, then life is good, something like that.
Yeah, exactly. And, one of my osteopathic teachers told me, because for the first couple of years, I was actually experiencing in my body whatever that person who was on my table was in the office trying to fix, whether it was their headache or their gut issue or whatever. I would feel it in my own body. And I eventually told him, and he was like, that you're not actually helping them by taking on their pain. Like, you're actually being not as good of an osteopath by giving of yourself in that way. And I think that can be applied to all the people out there in terms of like feeling like you're doing something really good, but your help is not actually penetrating when you're doing in this way, that this self-deprecating kind of forgetting yourself kind of way.
I'm so glad you brought that in. I'm having a memory of us sitting on the beach in Santa Monica, like, I don't know, 6 or 7 years ago, talking about how we can be of service to the people that we work with while maintaining our own sense of resilience, maintaining our own inner connection. And for me, the inner connection is the revolutionary love. Like, when I'm paying attention on purpose inside my own system, not out there trying to pay attention to everything else, that's the act of revolutionary love. And we came up with this like really simple technique that I still use every single day, as we were kind of talking back and forth about, okay, so if we're such helpers, how do we not give it all away? And we both came up with, what if we track as many sensations as we possibly can on the inside of our own bodies and fill up our entire bodies with our awareness, and there's no space for anything to come in. We're not giving anything away that we shouldn't be giving away. And there's just pure presence there. And to me, that is absolutely a version of revolutionary love and resilience. So I just want to appreciate, this way that you've helped me look at it over time.
Yeah, that's a good tool. I like that tool. I use it all the time as well. And I also we've all probably been on the other side of that, where you're in with a great therapist or you're in with a great healer of any dimension or lineage, and they're not necessarily doing anything in particular except being completely present in their own body, and then how that can really help in the dynamic of that exchange. It can help the person who's there being healed be really present to themselves and shift their own energy and shift their own trauma and shift their own injury. And it's not necessarily about what the therapist or the healer is doing to the person, but what they're inspiring them to do to themselves.
Yes. Yeah. I felt myself just jump out of my chair and on my soapbox and really happy.
Yeah.
Yeah. So this is a beautiful transition into your work with your patients. And I'm so curious about how the concepts of revolutionary love and resilience come in how you view them, how you interact with them. And I'm particularly thinking of clients who may be suffering from something like complex trauma, when there are multiple layers that you're looking at that need care and attention and healing. And I know that is an enormous question, so I can break it down for you if you want, but let's just jump off from there and see what comes.
Sure. So we talked a little bit already about, I'll just return really briefly to that notion that resilience only comes through when you're having a really hard time, basically, and you have to kind of trust fall into that process. And that's often where I meet people, is they've been to 8 or 12 or 15 specialists and gastroenterologists and rheumatologists and whoever else in the medical world, and they've been given a lot of medications, but not a lot of answers. And they're often, actually all too often, in their paperwork that they're filling out with me, I'll hear this narrative of I just want a practitioner or a doctor who's going to listen to my story and be a human being with me. And I'm like, wow, it took them 10 years to get to this point of knowing what to ask for. So yeah, I meet them in this sort of collapsed, sort of exhausted state. And oftentimes I'm just starting the conversation off with I am so sorry for what you've been through. Yeah. And deeply listening to their story, as you know, as a trauma therapist, is a big part of the healing, a big part of the start of the healing. And, osteopaths had this other tenet. I mentioned one of them, that the human is comprised of mind, body, and spirit, and that it's our job to apply that to our treatments. But another one of those tenets is that everybody's system, everybody, including animals, so every living being has an inherent healing mechanism that exists inside of their body. And it's the job of the osteopath to help them reunite with that mechanism, that inherent healing, that inherent drive, that inherent will to live, and ultimately that inherent resilience. So my job is not to take their pain away. My job is not to absorb their pain, but rather to help them figure out how to heal their own pain. So, basically what that looks like in my office is A, listening to their story. B, people are usually really appreciative of another perspective with the concept of why things might have gotten out of whack. And they're usually relieved that there's an explanation, that their stomach aches started after they hit their head, and that there is an actual connection in the body between systems, and that it's not just neurology and gastroenterology and OB-GYN. This reductionist look or take or approach at medicine is not what it is in vivo in the body. So acknowledging that they're not crazy, these things are connected, and then showing them, helping them figure out how to reconnect their body to that unity.
Wow. As you're talking, I'm just noticing my whole body is melting. I feel grounded. And generally when I'm talking to doctors, it's the opposite. There's a lot of activation and fear and nervousness. And my sense is your starting place with your clients is the own revolutionary love that you have in yourself, which kind of supports the kind of presence. And I'm hearing that you're with them in a way that is validating their experience. You're acknowledging what they've been through. You're listening empathically. And the story I'm telling myself is that that's coming from the revolutionary love that you have cultivated and connected with in your own being. And then through that, they get to probably get a sense of that in their own bodies, their own hearts and minds, having that reflected to them.
Yeah, I think that compassionate listening is a huge piece, and I'm sure you could talk a lot more about the dynamics of that. And then we're also, adding in the touch part of that with that in mind can be really potent because, as you know, not a lot of therapists touch their patients, but oftentimes I'm having a conversation about what happened when you were 10 years old while I'm on your sacrum where you fell when you were 10. And so off the monkey bars or whatever. And so having that contact also in a kind of compassionate listening way, because I'm not really doing anything to the sacrum. I'm not putting a lot of forces. I'm just meeting it where it is and holding that space, so to speak. And that's really bringing the body into the memories and the mind and the trauma experience, and like kind of reconnecting those two pieces together can be really potent for the healing process.
Yeah. I'm really getting a sense of the holistic care that you're providing, that you're working on so many different levels, and there's a sense of holding with everything you're talking about, everything you're doing, all the ways you're interacting and your orientation, that it sounds like it really helps your patients be able to allow their own resilience to just naturally unfold instead of you like doing something to them, that there's an allowing. I keep thinking of that word as you're talking with the way that you're approaching their care.
I think people really appreciate, I know I appreciate this. I think that the osteopathic approach that says that everybody has the potential to heal themselves is really appreciated by patients because they want to be empowered. They want to know what to go home and do to help this move along. They don't just want symptomatic relief. They don't just want a pill, contrary to what a lot of doctors say, like, oh, our patients are lazy or whatever. But as soon as you listen to them, they do really want to know that they have the ability to heal themselves. And osteopathic philosophy says that they can.
I love that. Do you have a moment, and of course, honoring confidentiality, but if anything comes to mind where you felt yourself with a patient in this way or working with them over time, and where you kind of like watched them walk out of your office for the last time and you felt like really uplifted or proud or like having faith in this work that you do?
I have a specific patient. It's one of my more it's one of my more kind of notable shifts that I've been able to see in my practice. And it was a little, I think 11-year-old or 12-year-old girl. And I think I've told you this before, but like teens and that kind of area of life, that phase of life are my favorite people to treat because they're like little adults and you can speak to them like with rational ideas and they're like, oh, I get that because I'm an adult now, but their bodies are still sort of soft and malleable and they don't have that much trauma stored in them, usually, hopefully. But I had a little 11-year-old girl who was having a lot of learning stuff going on, and her mom brought her in because she was concerned that she had like she was paying for 36 hours of tutoring per week for this girl to get F's on her weekly quizzes. And granted, I think she was in one of these really kind of tough charter schools. She really was not getting it. She wasn't learning, she wasn't reading. And we kind of went back in time talking about her history, which was never talked about with any of her other doctors. or maybe never listened to. But her mom did mention that as a 2 or 3-year-old, they lived in Beijing or something, and she had an eye infection and had to be on IV antibiotics in the hospital for something going on with her right eye, I think. And I was like, that's interesting. So maybe we need to, look at what's going on in the eye. And she did notice, like, actually after 2 or 3, she sort of started falling off the curve in terms of language and this and that. So I said, okay, in my mind, that seems like a really important event. Treated her eye and went to that area that seemed like the traumatized sort of portion of herself and integrated it back into this health, capital H, that we're talking about, and sent her on her way. And I never heard back for a few months. And I was like, oh, maybe it didn't work. Maybe they got frustrated by my prices, or maybe I'd suck or whatever. But actually, she came back with like a twisted ankle or something like that, like 4 or 5 months later. And I said, well, what about the eye? What about, like, what happened? And her mom was like, oh, I didn't tell you, like, we have like 2 hours of tutoring per week, and she's getting A's and everything's turned around. And I've told everyone at her school that they need to come to you because, like, you're a miracle, like, whatever worker. And so we treated her ankle that day because there was really nothing else to be treating in her head or whatever. That symptom had completely almost resolved completely after just undoing some of the trauma in the eye, which was really cool.
Oh my gosh, I feel totally inspired. Just my heart melts knowing that this can happen, that people can actually come and get medical care and get relief. I come from such a paradigm where it's the opposite. And so this is really, really beautiful.
We've all been coming from this paradigm, where you only go when you're like going to die or whatever, because if you have something else going on any other level of the spectrum of not feeling healthy, you're not really going to get that much relief or help or answers. It's super unfortunate. I hope that we can shift that paradigm.
Yeah. Talking to you really, it's always like helped me believe like this is possible and there are the good ones out there. And it's really helpful to be hearing these stories. I'm curious if there are any practices you'd like to share with us. I know you, have taught yoga and have done all sorts of various practices in your life, or if you have any words of wisdom you'd like to share with us as we kind of wind this down that can give folks who are maybe challenged right now some inspiration or some grounding to continue to move towards revolutionary love and resilience.
Yeah, I think a common practice that I like to give comes from a tantric practice that I was taught back when I lived in Berkeley. And I call it the double down breath. That lineage calls it the double breath. But it based on this concept of that we were talking about earlier, that a lot of our culture, even the spiritual culture, is about giving away energy and going basically in the vector, general up and out vector, and turning that arrow around. This was like a big aha moment in my own spiritual practice, was that we don't need to be necessarily going from the earth to the heavens, and that we can actually bring the heavens down to the earth by just switching the arrows in our minds from up and out to down and in is a really good way to reconnect with your own health, capital H, that inherent healing mechanism, and also shift your energy to a more sustainable, attractive, health oriented, and in my opinion, spiritual kind of a vibe going on. Somebody who's really embodied. You brought up that word. So the double breath is pretty simple. And you can also add in, if you've done something similar like this, you can add in actually putting contact into your anterior tibialis muscle, which is the muscle next to your shin bone on the outside of your lower leg, and holding that with one or both hands on both sides, or maybe just one hand reaching down to the lower leg, and breathing into your chest, holding it there, letting half the air out, breathing into your belly. So you're pulling that chest air down into your belly, and then exhaling down the legs and out the feet. If you want to extend it to like the center of the earth or whatever, you can do that. So I'll talk you through it while we do it together. So it's about, let all your air out. Good. Relax. Breathe into your chest as much as you can, expanding through the rib cage. The clavicles widen. The back of the heart fills. Hold the breath there. Good. Relax the shoulders. Exhale half the breath out. So make sure you leave a little bit in that chest. Stop. Good. Pull all that energy. Inhale into the belly beneath the diaphragm. Pulling the chest air down into the belly. So now you've got filling both in the back body and the front body. Good. And then when you need to, exhale, release down and out the legs and out the feet. Now, and so you could do like a couple double down breaths per day in the middle of your day to just, whoa, okay, I need to bring it back into my body. Yeah.
And the whole time placing a hand or hands on the outside of the lower leg. So maybe sitting on the floor or just reaching down to place your hands there.
Yeah. If you're sitting on a couch, that'd be easy to put one leg up and put your hand on the outside of that one leg. It's sort of hard to be bent over on a chair and hold both legs and do that breath. So you kind of want to be in this upright, erect, seated posture to really get that full chest and abdomen breath in.
I love that. I love imagining the arrows going down while doing the breath. It's really helpful. It feels grounding.
Yeah. If we could all just be a little bit more grounded, can you imagine what the planet would be like?
Yes, it would be beautiful. Yeah. Wow. What an awesome conversation. I'm just so appreciating how long I've known you for and how much I just learned about you and the work that you do. And, you know, I thought I was your number one fan already, but it's increased since we've been talking.
Oh,
and I'm just so grateful to get to know you better, to get to know this work and to understand a little bit more about how these concepts get incorporated into osteopathy and specifically the way that you do osteopathy. And thank you for pushing your comfort zone a little bit and sharing some vulnerable details of your life. I know you're really trained not to. And so I'm grateful that you were willing. And I know that this is going to be really enlightening for people, both like wellness professionals and maybe people in search of care in their lives. So thank you so much for being here.
Thank you for the platform to speak on my favorite thing in the world, which is embodiment and osteopathy and these types of sciences. So I'm happy to get the word out, and you can always find some more info if you're looking for an osteopath who practices in the same way that I practice. The Cranial Academy has a good search engine online. I think it's cranialacademy.org. You can also check out some of the blog posts that I do on drkirstenmackey.com. And I'm also teaching about some of these sciences as it applies to Ayurvedic medicine in the Shakti School, which is an online program. If you're interested, you can look up Shakti School.
And if you're anywhere near Truckee, California, you can come and say hello, right?
Absolutely. I'm starting a practice in Truckee, and I work in a cute little wellness center that has a yoga studio in it and other amazing healer ladies and men and man. Would love to meet anybody who was introduced to osteopathic medicine through this podcast.
Beautiful. Oh, well, thank you so much.
You're welcome.
Thank you so much for being part of this show and being part of this love revolution. If you love this podcast, please share it with your people and leave a 5-star review so that we can get the word out. If you're a practitioner or on your own healing journey, head on over and check out creatingsaferspace.com, which is one of my passion projects and is open for enrollment now. You'll get access to it the moment you sign up. Or join my mailing list for all sorts of revolutionary love and trauma-aware support at shelby-lee.com. See you next episode.